It's everybody asking what happened, and I was like, I don't remember. I don't have a memory for it.
She waited months for this special moment, and she doesn't even remember it. It was a brain bleed that put 2 lives at risk. We'll have that story coming up today on the Morning Medical Update. Good morning. It's Thursday, November 10th, and I'm Jessica Lovell. We are live. Good morning and welcome to the Morning Medical Update. I'm Jessica Lovell. We're live inside the Dolph C. Simons Jr. Family Broadcast Studio. Today, we are discussing AVM, arteriovenous malformations, how they're diagnosed, the risks, and the treatment options. So make sure you send in your questions on YouTube, Facebook, and the Medical News Network. You can find links to all of those right there on your screen. We'll get there in just a moment. But first, we're making the morning rounds today.
So Micah was having a very difficult time keeping food down. Anything we fed him was coming right back up. And he was also having a really hard time breathing. You could tell he was using all of the muscles in his chest and even his neck to try to just support his breathing, and it was very loud.
So scary. RSV certainly making the rounds, as we have been continuing to talk about. And now one private school in Kansas City, Kansas has shut its doors due to an increase in student cases. ICU beds across the city are full of both pediatric and adult patients. Pediatric critical care physician Dr. Sean Sood joins us this morning. And Doctor, I know you've been working long shifts right there at the bedside with these parents and these children. Tell us about what some of these patients are experiencing. I mean, we heard that cough. It just sounds awful.
Yeah, thank you so much for having me on this morning, Jess. Our community, there's just a great prevalence of children right now with RSV bronchiolitis and viral illnesses in general. Each ICU bed is very valuable right now. Very appreciative of our KUMC adult colleagues letting us use their beds in adult ICUs just with an overflow of patients. And specific to your question about what these patients are experiencing, they're experiencing fatigue. The amount of energy and effort it takes for these children to breathe is sometimes overwhelming for them and requires greater level of medical support.
So how are you treating these patients? Maybe different than you would treat the flu or something severe. If like the flu were to get really severe, you treat it one way, but you know, RSV, what are you doing that might be different?
Yeah, it's a really great question. And you know, with the flu, if you catch it early, you can give Tamiflu. With asthma, you can give steroids or albuterol. With RSV, it's very much so just supportive care. And so fluids to help keep the patients hydrated, and supplemental oxygen and respiratory support to help the work of breathing of our patients and support them to get over this illness.
So Dr. Sood, though, why is this putting so many people, adults and children, in the hospital, in the ICU? Why RSV? Why now?
Yeah.
Why so severe?
Yeah, there's a lot of variables involved right now. Most children, by the time they're 3 years of age, have been exposed to RSV. So masking and isolating have been really good for COVID and bringing COVID numbers down. But now with the reopening, children that should have been exposed to RSV are getting exposed to it all at once for the first time right now. So there's a greater prevalence of the number of patients that are getting exposed to the RSV for the first time right now.
Well, I know I've got young kids. You've got kids even younger than me, little tiny ones.
Yeah.
What has this been like, though, for parents up there on those ICU floors? I mean, what are they going through, and what kind of questions? I'm sure they have many questions for you.
Yeah, it's overwhelming. It's very trying and taxing for parents. We try to provide the best medical care we know how to provide to our patients, and also the emotional support for parents too. Anytime a parent is in a pediatric ICU with a patient, whether it's a RSV bronchiolitis issue or a traumatic brain injury, we know that every admission is very, very trying and taxing, and it has just been very difficult. But I think our institution's done a great job supporting not only our patients, but their families as well.
And Dr. Sood, lastly, what symptoms should parents be on the lookout for? When should they seek further than just rest and at-home care?
Yeah, two things I think are the most important things to look at. Number one is work of breathing. So children have less muscle fibers and a different diaphragmatic shape than adults. Children are definitely different than adults, and the amount of energy they use to breathe is much greater. And so look at your child's belly. Are they using their subcostal or belly to muscles to breathe? Are they really sucking in from their chest or even up by their neck as well? So look at work of breathing. And the number two thing would be the number of wet diapers. If you have a young child at home with less than 4 wet diapers in 24 hours, call your pediatrician or seek medical care. I think that's really important to keep them adequately hydrated to help fight this illness. And I just want to lastly say is about day 4 of illness is the worst. So if they get diagnosed with RSV on the first day, know that it's an uphill battle, and then it'll get better after that. But it's really a lot of supportive care, a lot of suctioning of those goobers in the nose, and providing support to get through this illness.
Dr. Sood, I know there are many parents out there hanging on your every word, really trying to pay attention, because this is a kind of a mystery for some, and I'd never heard of RSV just until this last couple of years. So thank you for your information this morning. I know you're really busy. We're going to let you get back to work, but always good to see you.
Thank you.
Thank you. Well, having a baby, it's supposed to be one of the happiest moments in your life. But for Amy Lewis, she doesn't even remember it. What she does remember is the sudden severe headache she suffered at her baby shower, a headache that turned out to be a brain bleed.
Mama loves you.
This kiss means more to Amy Lewis than anyone could ever know without hearing her story.
Everybody asking what happened, and I was like, I don't remember. I don't have a memory for it.
Amy has no memory of delivering her son Micah, but she does recall the sharp pain in her head that landed her in the hospital.
The whole time I was basically hysterical because I didn't know what was going to happen, because it was her life and the baby's life on the line.
Doctors diagnosed Amy with a hidden condition called brain arteriovenous malformation, or AVM for short. It's a tangle of abnormal blood vessels that kept Amy bedridden for 3 weeks before delivering Micah by C-section. Because Micah was premature, he went directly to the neonatal ICU, while Mom returned to her ICU bed.
It's been very difficult having her in the hospital and at the same time having the baby in NICU, and trying to bounce back and forth to split my time up.
Nathan slept on this couch in Amy's room, never leaving his family, and using a wheelchair to shuttle Mom to Micah for quick visits. The first was the most memorable after missing his birth.
It was tears of joy. It was really good because this time I knew it was him.
Kind of let him take it.
With Mom and baby doing well,
how's it going?
Doctors are optimistic about using radiation to treat the AVM located near Amy's speech and movement centers.
We'll start thinking about timing for giving that little radiation treatment to your little tangle so we can get that thing to shrivel up and go away.
And please welcome Amy Lewis and her husband, Nathan Head, and neurosurgeon, Dr. Brian Milligan, to our program today. Good morning to all of you.
Good morning.
Good to see you guys. Amy, it's been 5 months since you had that brain bleed. First, how are you feeling?
Fine. I'm feeling fine.
Okay, and how is that baby doing? Tell us about Micah. He was just feeding. He looks healthy. He's doing well. Tell us about him.
He's healthy, and
he's amazing.
Yeah, he's amazing.
Well, looking at these pictures, it's reminiscent for me. I was a NICU mom. I know what those pushes in the wheelchair down to the NICU are like. I know what that feels like. Everybody just kind of trying to be, Nathan, you try to be in 2 places at one time. And how did you make it through? How are you doing today, kind of looking back on it?
Great. I feel like things are finally getting back to normal. I'm back to work, and Amy's done with all of her treatments and everything for now, and she's done with her speech, and we're just living a normal life again.
Well, we love hearing that. But Nathan, when Amy's head began to hurt, you both recognized this, and that's because Amy was living with AVM. She'd had an AVM bleed back in 2009. What was going through your mind, though, when this was happening again? You knew what it was, but now she's pregnant.
Yeah, it was very scary. I just wanted to get her to the hospital as fast as I could. And so, I mean, we jumped in the car and we left, no questions asked. So we just went straight to the hospital.
You knew what to do. Dr. Milligan, I want to ask you, Amy was transferred to us from Wichita. She's considered a complex patient. We can certainly see why. She's pregnant. She's suffered an AVM bleed before. Was it in the same place in her brain? And what was concerning you most? The brain bleed, the pregnancy? Kind of tell us about this complex case.
Yeah, when I heard from our transfer center about Amy and a little about her history, I started looking at her scans, and it dawned on me that this definitely could be re-bleeding from the AVM that we thought that she'd had before. Although the sending hospital was talking about an aneurysm, and it turns out she has a weak spot on the vein that's draining the blood out of this tangle, this AVM. And somebody had done an operation in the past and put a clip on the bleeding spot on the aneurysm, and the concern was when she first came up that she had an aneurysm. And although as I was looking at the scans, I thought to myself, you know, I still think this is actually underlying arteriovenous malformation. She had blood in the spinal fluid chambers in the brain, and the spinal fluid chambers looked big, and I felt that there was a significant risk that her brain pressure was rising from the blockage of the spinal fluid circulation. And so we asked the sending team to get her to us just as quickly as they could. And when Amy hit the door, it was clear that the spinal fluid circulation was one of her big problems at the time. And so quickly at the bedside, we put in a small drainage tube to normalize the brain pressure. And Amy started to be more responsive, and we knew that we had at least made the situation safe for the brain once again. But we quickly then got to work trying to understand, what does the AVM look like now? What did it look like before? Where did the bleeding happen along the AVM? How do we treat it to prevent an additional bleeding episode from happening? And then to support her through her feeling so unwell. As you saw on the video that Amy did, you know, she doesn't have much memory of that time in the hospital, and it doesn't speak a word to how she's doing now, but it says everything about how unwell she felt at the time. So seeing her recover and seeing the family today is fantastic. And at the time, though, it was really unclear how we were going to get to this point from where we started. But one of the great things about KU is that just within moments, we assembled a team of the OBGYN, the neurointensive care team, my neurosurgeon team, and the neurointerventional radiology team, who were going to take better pictures of her AVM and help us understand what was going on. So we were able to formulate a plan to at least support her through those first days, and try to weigh the risks to Amy and the risks to Micah, because we really wanted to get to where we are today with both Amy and Micah here and healthy. And it's a real testament to the team that came together in that first hour or two.
Amy, how far along were you in the pregnancy?
31 weeks.
So, Doctor, I want to ask you, so 31 weeks, that's a really interesting time in pregnancy. What was the goal then as far as trying to get her farther down the road there?
Yeah, I mean, at 31 weeks, she's just getting into third trimester, and it's really not a time to try to put mom and baby through an anesthetic, even if we were going to consider surgery for Amy's AVM. It's really a time where we want to just support both of them and get to a point where the OBGYNs and ultimately the neonatal intensive care unit pediatricians are going to be happy with how far along Micah's development is, especially lungs, so that when he's delivered, he has a good shot with regard to breathing. I mean, that's just so important. And so we gave her some steroids to speed along lung development and just really supported her through those first days until we got to a point where the OBGYN team and talking with Nathan, of course, and Amy, made the decision that around 33 and a half or 34 weeks yeah,
it was right at 34 weeks.
Right at 34, they were going to deliver Micah by cesarean section. And so once Micah was born, then the neonatal intensive care unit pediatricians could take care of Micah, and I could simplified the care of looking after Amy. So
you could separate the two and have two teams looking after both patients separately. Nathan, it had to have been helpful that you had a good understanding of what AVM is, and I want to talk more about that with Dr. Milligan in a minute, but that must have been a really stressful time for you. I just kind of want to hear more about what those conversations were like, because you're going in to have a baby, very exciting time, but you also know that Amy has this condition, and to know that they were meeting up at the same time must have been a very concerning moment for you.
Yes, it was. In fact, KU's great. They, they were on the phone with me the whole time on my way to Kansas City. Different team members from the team that Dr. Milligan was talking about, calling me and discussing options and get permissions for certain things. And I mean, they were just great. I mean, I obviously was very worried, but I felt like she was in really good hands.
That is a relief. I want to put some information up. There's a QR code on your screen where you can go for more information about AVMs. Like me, again, going along for the ride with a lot of people, as I learned a lot of these terms as they come up in these really fantastic stories. I was learning what AVM was for the first time. So for people who are hearing it for the first time, Doctor, explain what it is, where it comes from, and really who's at risk.
We haven't really been able to watch an AVM form, so most of how we think they come to develop is based on hypothesis and best guesses. But the best guess is that an abnormal connection between an artery and a vein with no intervening capillaries. These are the tiny blood vessels where blood cells are supposed to march one by one. This is where oxygen gets out and carbon dioxide gets back into the blood so it can circulate back to the heart. And without those capillaries in the way, then the high pressure blood just zips across into the veins that are really only designed to handle low pressure. Think about a rogue plumber entering your backyard in the night and connecting a pipe between your water main and your sewer, and eventually over time that high pressure water causes the sewer to back up, and then somewhere in the house a toilet overflows or a sink backs up, and that's really what an AVM hemorrhage amounts to most of the time.
Well, now you've made me understand what it is. See, I love it when you guys explain it in these type of ways.
Over time, the tangles become more and more complicated, and they develop the weak spots somewhere along the tangle. And in Amy's case, it was along this vein.
So if somebody has had this AVM episode, is it highly likely they'll have another one like Amy had, or could someone just have one isolated moment and they get treated for it and we never have to see them again?
We often find AVMs before they've bled, and best guess is that the risk of bleeding from an AVM is somewhere around 2% per year. So there are a number of patients where we find them where the patient is older or the AVM seems to be particularly high risk for treatment, and it's often safer to just observe than it is to actively treat it. Once they've hemorrhaged, though, once they've had a bleeding episode, then the risk of additional bleeding in the near future is much higher, and so we really need to think about treatment at that point. There are several different treatments that we can use. Typically, the treatments, though, boil down to 3 different things. Removal at surgery, partial blockage of the AVM with glue by going up with a catheter. We call that embolization by one of the interventional radiology colleagues. And the third is radiation, which essentially causes the wall of the blood vessel to thicken, and then that narrows down the channel for the blood to flow, and eventually once blood stops flowing through the AVM, then it's considered cured.
Amy, what's it like living with AVM or knowing that you have it? Is this something that concerns you daily, or is it something you manage on your own?
It's actually forgetful. I forget that I have it until something like this happens. It's like, I gotta go to the hospital.
Is it painful? You feel tell us what that feels like.
not until it's happening to you do you feel anything. You don't even know it's there.
All right, I want to take a quick break. We're going to check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. We'll get back with Amy and Nathan and baby Micah here in just a moment. Dr. Hawkinson, we got cute baby on today.
Yeah, I mean, that needs to be more, either a cute baby or cute puppies.
Right, right.
Yeah, so right now for the COVID count here, we have 20 active infections in the hospital, 2 in the ICU, 1 on the ventilator, still 14 in that recovery period. So numbers are holding steady. We would still like to see them lower, but obviously they're lower than what we saw in those trends from when we presented on Wednesday, when we were up into the mid-40s within these past few months. So hopefully it can continue to go down.
Okay, we're going to go back to RSV. Dr. Sood was on earlier talking about that, you know, but nose swabs may help distinguish babies with RSV who need longer intensive care. So a study is linking more severe RSV with greater damage to the cells that are lining the nose. What are your thoughts on this? How might it help with testing and making sure those kids are getting the care they need?
Yeah, I mean, so we're looking here at maybe a prognostic factor. How long do you think they'll have severe disease? How long do you think they'll be in the ICU requiring non-invasive or invasive ventilation, i.e. intubation? I think this is a good early study, but certainly more data needs to be collected as far as the clinical utility of this. You know, there have been a lot of RSV news lately with prevention, with vaccines. This is one more thing, maybe more in the treatment realm. Good initial study to look at initial prognostic factors for disease severity, but I think it's still a lot more has to be done as far as looking into this this study or this data.
Okay, so a national study is finding that long COVID is affecting women more than men. Why might that be?
You know, I don't think we know. I think we have to understand there are complex interplays between genetics, but also maybe hormonal areas and reasons. We know that there are just different reasons. There are differences between men and women. You know, I think we have seen some of this, not necessarily this question being asked, but certainly in a lot of the long COVID studies that we have seen, whether they're retrospective or just cohort studies, looking, and we kind of have seen a trend more towards female patients having experienced more of the long COVID. So I think it's a good thing to evaluate. But again, it's going to be complex interplays in genetics and all that kind of stuff.
All right, let's see if we have reporter questions on the line today. Let's get to our community. Okay, Jamie wants to know, how long will Amy be in rehab? Amy, what type of recovery are you going through? Is there rehab? And also, Jamie is asking if you have any memory issues that are lingering.
I have memory issues, but I went through the speech and the exercise thing, and I'm waiting 5 months.
To go back to radiologist.
Yeah, go back to the radiologist, and they'll send something through me and figure out how it is. They went and shot the AVM twice, and I think they killed it. Sorry.
Cindy wants to know, is pregnancy something that can trigger a brain bleed? Do we know that, Dr. Milligan?
So we don't think pregnancy is associated with bleeding from arteriovenous malformations. Certainly preeclampsia and eclampsia are conditions in pregnancy associated with very high blood pressure, which can contribute to bleeding from AVMs, sure, but that's uncommon. Often people will have spontaneous bleeding episodes if their blood pressure is particularly high. Amy was experiencing some rising blood pressure around the time that the decision was made to deliver Micah, and that was another contributing factor to the timing for Micah's delivery, to allow Amy to be done with pregnancy and allow the blood pressure to start to return to normal.
So Tim's wondering, what is the long-term care for Amy? Will she have to, how often does she have to come in and get checked up? And, you know, what is that going to look like long-term?
Yeah, since we treated Amy's AVM with highly focused radiation, we actually took the tangle and divided it into 2 geographic portions and treated one section on a day separated by about a month. that process of thickening the blood vessel wall, which is what radiation does, and causing the blood flow to then stop going through the AVM, that process can take 2 or 3 years. So in 5 months, Amy will come back and we'll get an MRI test looking at the blood vessels, and we'll, I'm sure, still see some slowing blood flow through the AVM, but over the course of the next couple of years, we should watch that diminish, and once we don't see any flow anymore, we'll get a final catheter angiogram. One of the radiologists will probably go in through a wrist artery nowadays and go up and shoot some dye and take final pictures and make sure that there is no more blood flow going through the AVM. And once that's the case, the AVM is considered cured and no additional checkups will be needed after that.
Food or diet, exercise, how does that play into the equation when it comes to preventing or post-care for yourself?
We don't know any particular diet that's especially helpful. I think staying balanced is important for any kind of recovery, whether that's from brain bleeding or other kind of stroke or any sort of surgery or anything. And exercise is important because it helps keep blood pressure normal. And we know that that's really important for reducing Amy's chances for having another bleeding episode.
Okay, Shirley has a question, Dr. Hawkinson. She wants to just talk about adults with RSV and just kind of what you can share about it, because she's over 65. She tested positive with RSV and then it went to bronchitis. She was sick, really sick, for 2 weeks. She came here. She says she's doing much better thanks to her docs here. But what can we tell about that? We know that because we are not a specific children's hospital, we have both patients. We have children and adults. So what are we seeing and what are you hearing from your colleagues?
Yeah, no, certainly in my experience with RSV is in that adult population, and I think especially those patients with comorbidities, even age. So certainly above 60, above 65, you are having that higher risk of needing to be hospitalized. And there is that higher risk of mortality as well. We know that in the CDC statement, I think it's 14 to 15,000 people a year die of RSV. This is adults who are over 65. So it is certainly a risk factor, even though we most of the time consider RSV a disease of the very, very young. Certainly the very old. And in my experience also, we do see patients who maybe not age, but have those things like cancer and are on immunotherapy or chemotherapy, or those bone marrow transplant patients. There are some therapies we are able to use. We don't use those in everybody, but certainly if you are in that higher risk category, we take every case individually and weigh the benefits and risks of some of that treatment. But again, this is not necessarily FDA approved therapy. There has been studies to show support and benefit of these things. But it is one thing that we are concerned about, and if you come in and you have those comorbidities, we are going to be aggressive in giving you that supportive care to hopefully get better. Most people do recover, even the elderly, but there is that higher risk for those elderly patients or those patients with things like immunosuppression as well to have those adverse outcomes for sure.
I want to get to final thoughts from our guests today. Amy and Nathan, I'll start with you, and I'm glad to see Micah's face. I was worried I was completely boring him all through this program. So but he's finally come awake. Just what do you want folks to know just about, again, taking your health seriously, looking for the warning signs, making sure you're taking care of you and each other?
Basically just, just don't ignore the symptoms. I mean, if it's something that you think you might have, then go straight to the hospital. Don't waste time, because time is of the essence, and if it wasn't for KU and Dr. Milligan, I don't think these two would be here today. And it's a miracle.
Very powerful. Amy, any final thoughts for our viewers today about your story and just how you're doing and what you want folks to know?
Go to the doctor. Go to the doctor anytime you feel weird.
Speak up, say something, ask questions. Yeah. Dr. Milligan, they give so much credit to you, but I think you'd probably give it right back to them, right?
I think both right back at them and to the whole team that we were able to quickly assemble. You know, my colleagues from OB and neurointensive care and neurointerventional radiology and the radiation oncology folks. I mean, it really took a village to take care of Amy and Micah, and I'm just it's really fantastic to see them today and to get to hear from them and talk to them.
Isn't it, though? That's great, isn't it? Okay, well, when we have cute babies on, that means we have to get pictures. So as Micah gets big, there's yawning again. So send us photos, keep us posted, and just much luck to all three of you. I'm glad you're back to just enjoying your new baby and living life and being happy. So thank you for joining us and sharing your story.
Yes, thank you so much for having us on. We appreciate it.
Yeah.
I love it. All right, Dr. Hawkins, you have to follow a cute baby again. Sorry.
I don't think I can follow that. I wouldn't do it any justice. But you know, thank you to our guests and thank you, Dr. Milligan. We have patients we collaborate on for various reasons. It's always good to work with him and all of his colleagues. And I think one of the questions that we had today was about RSV. You know, we do a lot of times pigeonhole it into pediatric disease, especially newborn and very, very early childhood disease. But as we heard from the person who asked the question, adults can get it too, and especially if you have those immune compromising conditions or older age, you are at risk. But I think there is some light at the end of the tunnel. We know that there are some vaccine candidates that are being evaluated with some good data behind it, so we're happy about that. Hopefully it will become available soon, and we can provide one more protective measure against a viral illness, especially RSV.
Doc Hawk, thank you so much. Again, thank you to all of our guests today. All Things Heart is coming up at 10 a.m. and host Alexis Del Cid joins us with the preview. Good morning, friend. How are you?
Good morning, Jess. Gosh, that baby was so cute.
Right?
It's a case of the babies now. I just want to snuggle it. Today, we have a really interesting episode of All Things Heart. We're talking about a type of cancer called multiple myeloma. And you're going to meet a patient named David who'd never heard of it until doctors delivered the diagnosis to him. He says the symptoms included pain unlike anything he'd ever experienced.
And they was real sharp, like spasms. And I had no clue what it was. And when they hit, I would fall all the way to the floor. I couldn't stand up, and I would just cry because I couldn't tolerate the pain.
It just sounds horrifying. And once he was diagnosed, he was relieved. But then he had this epic battle ahead of him because the very treatments could also cause problems for his heart. So coming up at 10 a.m., we're going to talk with David. We're going to learn more about his journey. And also a cardio-oncologist will talk with us specifically about what it is about those treatments that has that heart connection. And we're going to have one of David's cancer-fighting doctors on. She is a fascinating person to speak with. And she talks about the life-saving treatment and why African Americans have a higher incidence of multiple myeloma, yet have a very low rate of being able to access this kind of treatment. We're going to explore that as well coming up at 10 a.m.
That's going to be a great episode. Alexis, thank you so much. We'll see you here in about an hour and a half. Thank you so much for being with us today. You can catch our updates anytime by logging back onto Facebook, YouTube, and Twitter. Go out, make it a great Thursday, and we'll see you back here Friday at 8. Grab a tissue for this update as one of our team members offers the ultimate gift of life to his coworker in need of a kidney transplant. How this surprise all began. Friday at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.